Namaste and a very warm welcome to Women of Wonder by Reema Mahajan. I'm your host and host Reema, and this is our space where we spotlight women who are creating impact with purpose. Today's episode is a deeply important one because we are talking about something many women silently carry, but very few of us discuss this openly: fertility, IVF, motherhood, and the emotional journey in between. Our spotlight is on Dr. Sreelatha Gopalakrishnan from Almond Blossom Fertility Clinic, a leading fertility expert helping couples navigate one of life's most personal journeys. From IVF myths to real hope, today we are unpacking fertility with honesty, clarity, and compassion. Welcome to the show, Doctor. It's lovely to have you here. I can't wait to dig deeper into fertility, gynecology, and all things mysterious. I want to start with breaking the myths. You still have time. Are women being lied to? And, do you think are women being lied to about their fertility times? Is that a myth or a truth?
Actually, time alone does not matter for a woman's fertility. It's multifactorial.
Mm-hmm.
It's a beautiful interplay of your biology, your genetics, the environment which you are in, and the time frame that you are in, apart from the priorities that you have. There's a lot of fear marketing or fear mongering over this time being the most crucial fact, because from our young days we hear this biological clock which narrates into time. I wouldn't say that age in terms of time would mean age, but then I don't think age alone is a factor that affects your fertility. It is, like I said, there are a lot of other things that come into play. And when we're talking only about the woman, right? But interestingly, even the man's age is of importance. That's always been not spoken about. But yes, both their ages are important. But apart from that, is their lifestyle, is their genetics, is the environment that they are in, is the body's country, the biology that they have, and how they are placed at. I think that is more important.
Wonderful. So one of the most common saying is a woman's biological clock and career clock are opposite. That's in today's age and time, women who want to have a career specifically, want to work in the corporate world, run their own businesses and have a busy lifestyle, do not have time to become moms at early ages. And then is IVF the only option when they decide to become mothers later?
I think awareness is the best option.
Okay, tell me more.
I think it's important to know where you stand. And all it takes is a simple blood draw to know where you stand in terms of your reproductive decisions, because, your entire trajectory can change based on that blood draw. Example, woman, 25, a simple blood draw, which is called the AMH, the blood test is called the AMH, AMH of 2.5. She still has time on her hands, provided she's looking at having her family started off. Maybe in another 2 or 3 years, she's seeing somebody she intends to settle down. Age 26, 1 year older, but an AMH of, let's say, 0.67. And again, considering having a family, maybe 3 years down, maybe she's looking at other options. Maybe she was looking at a promotion. She's working towards it. Maybe she should actually see a doctor, her gynecologist, and understand what her options are, to understand why this AMH is slightly on the lower side. First, what are her options? Should she just consider speeding up that, marriage, which she's actually putting up for another 2-3 years? Maybe she just goes for egg freezing. This is a discussion. So if you ask me, I think it's more the conversation that you have based on the blood draw, which will give you awareness as to which way your reproductive decisions can be made.
So at what age do I need that blood draw? When should women consider
25
going?
and above.
So if you are 25, you're a woman, you intend to get married and settled at some stage, you want to have kids in the future, you should go meet your gynecologist.
Just ask for us. I mean, there are a lot of companies who just offer the services of AMH at your doorstep. But at the same time, your gynecologist can also do that. You'll see a lot of ads for fertility profiles which include the AMH. So, just get it done. Just like how you would get your annual health check done, just get it done. And most of us tend to either Google these numbers, ChatGPT this, or,
Today,
Gemini.
ChatGPT is the new doctor.
Yeah,
right?
So just look at it, but then also go across and have an honest conversation with your gynec as to what your plans are. where you're placed and where you intend to be. So that becomes a little more clear.
So I'll tell you typically from where I'm coming from. When I was that age, 25, 26, if you're having your periods regularly, your fertility is fine. That is, your menstrual cycle is on point. Is that still true? Having regular menstruals, does that mean
Not necessary. Yes, if you're not having your regular cycles, it's definitely a red flag.
Then I would definitely go to a gynae. But otherwise, I will not show up on your door.
No. Most people that I see, most women that I see, I think they all go, even if they go back home, like we are expats from India, when they go back to India, they all do a regular health checkup. Most of them do an annual health checkup somewhere, Lalpat or, Fertility Labs or Metropolis. They have those executive health, they do that. Just add this one extra blood work. That's about it. It tells you where you stand. That's all it is. So if you ask, our times we were not aware that we had these options.
Yes.
But I think now it's more out there. Recently, I think the South Indian actor Ram Charan's wife was in the news, and she had actually spoken about egg freezing. Now, they had their kids. She had frozen her eggs when she was young, and then she had her children using those eggs. It just popped up. I'm very new to social media, and it just popped up on my feed. And I was looking at the comments, and I was surprised by the bias that people have. Hamna, we like to put money aside as an FD. Okay? We like to buy gold and keep aside as an FD. Why not egg freezing as something you keep aside for your girls, just in case something happens? Today I was a little late, as you're aware. I had a consultation which popped up the last minute. It was a young girl, 37 years old, and walks into the office with this option of wanting to egg freezing. The interesting thing is she's just had a diagnosis of cancer just yesterday. And she was totally clueless about any of these options that are there. So it took me time. Firstly, it is very emotional because, when she saw a woman sitting across the table and, you can read, you would read faces, right? So she kind of just broke down and she said, I'm glad it's a woman that I'm seeing across the table. And I'm glad you're patient with me because she's never even had a proper ultrasound until this problem that cropped up 5 months ago. Till then, she thought her life was, she works for a corporate. She'd just gotten a promotion. And she thought everything was set. But unfortunately, I sometimes say, life is what happens when you're very busy making other plans.
Yes.
She was trying to actually, now that she's got a promotion, she was looking at options somewhere else. Like, move, work for a few months in another place and come back. And when this happened, and sometimes I think, wish she knew that, now, let's say if you're going to do this egg freezing, it's going to be a rush for her.
Yeah.
It's going to be a rush. It's going to be, she's already overwhelmed with this diagnosis. It's not even sunk in yet. Then we're going to push her with hormones to do an egg freezing in another 10 to 14 days. It's not easy on the mind or the body suddenly. So I think it's important that, when you have your health checks, include a gynec check. Most corporates now allow it. Just ask for it.
Just ask.
And just add one more extra blood test to it. And that is, I think now everybody's aware of thyroid.
Yes.
So uske saath one more. That is your AMH. That's about it.
So for the audience, I want to ask you, what's a good age for egg freezing? And does doing egg freezing at an early age ensure future motherhood?
There was a recent study which came out, which says that out of all the women that have used frozen eggs, it's 10% that have actually used them. Okay. It just gives you something. It gives you, I keep saying, a front row seat at motherhood later. If in case.
So it's like an insurance you might not use.
Exactly. But you still stay insured, right? Again, like the FD that I was talking about, a fixed deposit for later use. You don't know when it can come handy. So that it is just there. The younger you are, your eggs are much more healthier. Chromosomally,
So what's that age? Is it 20? Is it 15?
20 would
is
be
it
too young.
25?
25 would be your right age to step in and start considering. Like I said again, there are a lot of factors that go. Like, for example, if you've had diagnosed with endometriosis, that again is a common thing that's there nowadays. At 25, and your AMH is 1.5, I would be more inclined to freeze the eggs, keep it aside, and then consider, like, maybe, seeing whether a surgical intervention is required or a medical intervention is required, whatever intervention that needs to be done for these interventions are based on the size of the endometriotic cyst, the intensity of the symptoms that the women have. So, based on that, the decisions can be made.
Right.
But egg freezing, with those conditions, definitely, I would definitely advise women to consider 25 above, I think, is a good time to start considering this.
Interesting. So I hope whoever is watching this podcast, this is one of the biggest things I have done today. I did not know about it, right?
Yeah.
Egg freezing, seeing a gynae at 25, getting AMH test done. So many new things which I don't think are spoken that much in.
It is important that we talk about cardiac health, we talk about cholesterol. Everybody is very worried about the calories they're taking in. I keep thinking, somebody should step outside and start talking about reproductive health.
Yes.
Most women, especially our population, if you ask them, have you had a pap smear? Nope. A breast scan kabhi hua hai? No. And then you ask them, okay, have you had, first timers, most of them who are walking into a fertility clinic through a referral from a gynec have usually had an AMH done, okay? But the others who've just walking in, they've not had an AMH. So, they are clueless. And some of them who've done actually start panicking because they do the Google's research, and the Google research says you're not going to get pregnant again. Low AMH does not mean that you're not going to get pregnant. It just helps you, like I said, how to plan your reproductive journey. That's as simple as that. It helps you it pushes you to go and have a conversation as what needs to be done about the state that you are in. So, yes, it is important to include this as part of your general health check.
Wonderful. So let's talk fertility and IVF now, right? So is fertility mostly the problem for women? That's my first question.
No.
And my second one is IVF my only option
No.
if I have fertility issues?
Interestingly, when you talk about fertility, it comes with the man in the equation or your male partner.
But it's mostly
in the
like, something's wrong with her.
That is how it happens.
Yeah.
What happens? Because, jab dikhta hai na, they see the ladies taking the medication, the lady is going for the scan, the lady is getting the procedure. So, usme kuch kharabi hogi. That
exactly.
Is how
that is the mindset. That is what is thought about, right?
And even we women are trained to protect our men. I don't think I know of many of my lady patients who've actually spoken to the family that it's my husband's problem and we cannot have a child because of it. So we are doing this procedure. It's generally considered.
Never mentioned.
Because, and I like that partnership that they try to protect. I wish it also worked the other way around where, when it happens to the woman, where the husband... like I said some time back, the generation is changing. I see more men standing up for their wives, stepping into the offices with their wives, holding hands and sitting with their wives. Actually, especially from the space that we come from or the place that we come from, it's a huge change for me. I've come from a generation where women were doing everything by themselves. They'd either come with their mothers to the visits or they come with some family member. The husband's always working, but now the husbands actually take time off. Come to the clinic with their, wives, stand there, try to understand, try to learn. And sometimes I tell the men to learn how to do the shots so that, they're involved in the process. So what happens is they know what's happening.
So the trend is changing now.
Definitely changing.
So men are more a part of the journey of IVF.
And also in terms of how much they contribute to the fertility journey has actually moved up.
Okay.
There is more male fertility now than before. So it's 50% is a man now and 50% is a woman. Okay, so it is not always a woman's problem. This is my answer to your first question. Is it always a woman's problem? No, it is not. 50% man, 50%. Just like how even everything else is equal fertility journey. Because when an embryo is made, one cell from the father, which is the sperm, and one cell from the mother, which is the egg, come together to form an embryo. And that goes on to become the baby later. So it is 50% contribution.
Yeah.
And also problems also are 50%. So it is not only a woman's problem. Yes, when you look at it from the outside, it's a woman who's having to take the shots, woman who's having the procedure done, woman who has to carry the baby. Everything goes on on the woman's side because we are created by God for this purpose. In the sense, biologically, not the other way around. What I mean is, that's how we've been created.
I think that's how beautiful a woman's body is, that they go through all of that.
And I don't think fertility always means IVF. A small example. I've had a few patients that came in the month of February. And in fact, I was asked, these many patients had come to you, what was the outcome? And I did tell them that, of them, tubal flushing, just flushing the tube, had gotten 2 people pregnant by the end of March.
Okay.
And I told them, after I flush the tubes, you go back, try for 3 months. If it does not happen, give us a ping and I'll tell you what next. We didn't push any IVF across the table to them. We just told them that this could help you. Yesterday, I had a couple who came in through a radio talk that I did some time back and got pregnant with a simple insemination.
Okay.
Because the husband did have a problem. We just did a simple insemination. It was nothing big. It was not IVF again. And today I was just telling my nurse that maybe I should start something called a twins association in Dubai, because from the looks of it, I have a feeling that it's going to be a twin pregnancy, because when you look at the numbers, you get a clue. So every time we actually have a couple inside the room, we are actually looking at 4 different people there. It's not just the husband and the wife. It's the sperm, the egg, the husband, the wife. So we have to correct all the 4 of them before we decide which way we go. There's always step 1 that we try to fix. It's like a detective trying to find out where the missing puzzle is. Because you try to figure out why it did not happen. Okay, so that's the doctor's job. So we try to fix it with sometimes lifestyle changes, sometimes supplements, and it works. Sometimes, like I said, a simple tubal flushing can work. Sometimes a 5-day course of a drug can work. When none of these work, that's when IVF is placed across the table. Let's say the tubes are blocked on both sides. Then you have, because not many people are aware, but pregnancy always happens in the fallopian tube. And if the tubes are blocked on both sides, there's no place for the fertilization, for the egg and the sperm to meet, for them to form a baby. So then what happens? But natural that you'll have to go for IVF. So those are the conditions that, IVF would be the first line of therapy. But otherwise, it's like, slow, steady, and finally the push. Otherwise,
So I'm very curious, doctor, about your journey. What made you choose fertility treatment out of all the possible, medicine lines out there? How did you land here?
I could say that fertility chose me would have been a better way of saying this. I did a small stint in oncology.
Okay.
And I'm from Bangalore. And there's this place called Kidwai. And it was emotionally very overwhelming. There was a lot of abandonment that was happening. And it's gynae oncology at the end of the day. In India, you don't have so much of counseling and stuff like that. For a support system for women was low at that point. And I'm talking about 2004, 2005. And I went back home and I told my dad, I don't think I can do this any longer, because some of their journeys, irrespective of the fact that I'm trying to give hope, I don't think I will be able to help them, because, every step it drains them. First, it drains them off physically. Then it drains them of family support. Then it drains them of the strength that they have within them mentally. And then they're in depression, trying to fight an illness, which possibly, because most of them who come to the center that I was a tertiary care, they've already been through the first few layers. So, they are at that end where, And it's just a question of time. And I kept thinking, my God, I'm at the end of life for these women. And I don't think I seem to. I still remember my first patient. Her name was Jayalakshmi. And she came from a small village near our place near Bangalore. So the first time the husband and the children with the daughter, she had 3 sons, with the daughters-in-law and grandchildren came to drop her. They would all come, stay with her. A month and a half, children stopped coming. By the end of the second month, husband stopped coming. And she was, there are a lot of NGOs in these organizations. So, she was under their care. And she was moved from the radiotherapy ward to the general ward, where, I don't want to use the word orphan because she's not an orphan. But at the same time, was treated like an orphan in the facility. So. And I could not take it because, she was the first history I've taken of that place. And I kept following up. So every time, once, twice a week, I would take some food with me to give her. And I couldn't see her crying. And that kind of was affecting me a lot. It kind of felt like, okay, this is not for me. Then my dad just casually suggested, okay, you can't help people on the other end. Why don't you go to the side where creation happens? And I very casually applied for a fellowship. I got through. And then, it was a very casual thing. So I'm pretty close to my dad. And when I was having this conversation, he said, just think of all the blessings that you must be having from all the people that you're trying to help. So don't ever think, because sometimes you ask yourself, what am I doing? And then he tells me this,
So do you have a count of how many babies you've had so far?
I don't.
Just curious.
No, I don't. I don't keep a count of. I like to believe that in between. I still believe that, I'm here with science. And my job is to just make sure that science is helping them on their journey. The destination, both me also, I'm not very sure because, fertility treatments don't come with guarantees.
Yeah.
So it is so for my job is to just make sure that the journey is comfortable, getting science into the journey and just make sure that, at least we've done the job well. So I don't have any pictures of babies in my office. Most of them do. I keep saying I don't want to take credit for all the babies that have been born because I don't think I was alone in that. It is the suffering of the couple that was there. It was a destiny of that embryo to make it because it's a miracle every time an embryo makes it. So, and I think I'd like to thank the Creator for what, for putting me in the middle of that journey. So
beautiful. That's really, really beautiful. So for a couple today preparing to come on this journey with you, they want to try for a child. They've been trying for a while. It's a journey of hope and heartbreak, right? They go through this. What's your advice to somebody embarking on this journey with you? How do they remain emotionally stable, yet strong, yet together when they decide to come to you?
I think fertility journeys are much more tougher than mothers-in-law, if you ask me.
Yes.
If you can survive a fertility journey and you're still sticking on at the end of it, you can survive any storm on this planet because when a woman is on this journey, she's going through all the injectables. God's created a woman to produce 1 egg a month. Now, when you start injectables, I'm specifically talking about IVF journeys now, okay? So it's going to be a lot of, because, when the audience listens to me, they might think, oh my God, for everything they're going to give injections, then I'm not going to go.
No.
In IVF, we tend to try to produce more eggs in a woman's body, which needs injectables. So imagine being emotional or angry, like how you would have a PMS every day from the 5th day to the 12th day. That's almost 7 days at an extreme.
Yeah.
That is tough. It's an emotional roller coaster ride. So, I keep telling, it is difficult. Today I had a couple who came into my office and she said, my husband was saying I'm not behaving like the regular me. I said, I'm not surprised.
That's hormones.
It is your hormones. Anytime anything happens, either you blame me or you blame your hormones. One of this. Choose whichever. I have no problem if you blame me also because the hormones are coming across from our table. So you can. So the hormones actually make women go through this very emotional phase where they could feel very lonely, they could feel clingy, they would want to cry, they would feel lost. Especially the generation today, most of them are high achievers.
Yeah.
They're used to getting things very fast. Like, everything is instant Wi-Fi.
Everything is available at a click these days, right?
Instant Wi-Fi. Just that, they're just shocked that their biology is not as instant as it should be. And the peer pressure also matters. For example, they're surrounded by people and, somebody's having a child, somebody's having a naming ceremony, somebody's just gotten pregnant, somebody's having a baby
whole
shower.
circle is getting in that phase.
Yeah, so, that again, that peer pressure is there. I mean, all of this matters. And if you have a partner or a family that can stick with you and support you through this journey, nothing like it, honestly. And I think the biggest counselor should be the spouse, apart from a counselor that can come from the facility where you're doing. I mean, we have a counselor who's actually trained for fertility. But apart from that, I think we should actually, be able to educate the family and the partner that, you just stand your ground. If she says, no, I want to be alone, it's okay. Sit silently in the same room. Don't walk out, because most men have this, she said, I don't want.
Yeah. So
just stay around. After some time,
she
will want to open up, and you will be there, and you will be grateful that you were there holding her hand when she did open up. So small things like that, I think, matter. So if you ask me, the biggest test for most marriages would be their fertility journey.
Yes. And I mean, they go through so many ups and downs. And especially, let's talk about women going through PCOS, thyroid, endo, right? Is IVF an option for them? Is IVF possible for them?
It's definitely possible. Is that the option for them or the only option for them? No. You have prior options. Like I said, fertility is multifactorial. For example, if only your thyroid is a problem, you can fix that and still get pregnant with a little guidance from our side. You don't need any of the assisted reproductive techniques. When I say this, anything from inside the lab. You can still get pregnant naturally. PCOS, depending on the severity of your PCOS, okay, you might just need a little help from us and you can still get pregnant. But again, here, all the other factors matter. The quality of the sperm, if the sperm DNA is fragmented, if your thyroid is good, is it just PCOS? Is there anything else that we're missing? All this matters. And then it would work. Endometriosis depends, again, how big the endometriosis is, how much it's affected you, and if your tubes are open, because endometriosis can affect the tubes as well. So if your tubes are open, if the sperm parameters are good, not necessarily always IVF. IVF is the other end of the spectrum. Assessment is the first end of the spectrum. So, I think from assessment, guidance, little intervention, and finally would be the IVF. So that's how I would like to put it. It's not always IVF.
And what happens if my first IVF cycle fails? Like, what is your recommendation? If somebody's gone through that treatment once, how do you decide whether to go for the next one and how many is too many?
I think IVF is like, losing a battle. And I would normally want the couple to grieve first. Because, you don't have anything to show for what you've gone through. And it is like, it's like being pushed off a cliff, not knowing where you're going to hit when you fall down. So most of them are going through that. It's a very difficult conversation for most of them to have. And most of them feel that, they've been betrayed by sometimes the doctor. It's a feeling, okay, now the doctor must have tried the best, but they feel betrayed by the doctor, betrayed by God, because we always blame God in most of our equations. Betrayed by God, betrayed by fate, all this. I'd like them to grieve, talk to somebody, and then decide, okay, now that it's done, what next? Most of the time the question is, why did it fail? For me, I think the thing would be, what did I learn from that failed cycle? And what mean, I'd like to put my best foot forward now. Again, doesn't come with guarantees, but make sure that, okay, because whatever happened in that failed cycle is data. That's information. Whatever can be tweaked and twisted so that we can get better results should be implemented before we go forward. Most of the time we see people rushing through a cycle. Not necessary that you have to keep rushing into a cycle. Maybe sometimes you just sit back, evaluate, maybe work on your lifestyle. There are people who just don't want to, for example, there are husbands who just don't feel that, smoking is really bad. So what they think is like, my colleague, he was smoking 10 a day. Lekin banda, he was pregnant. So, it's okay.
It's okay.
So
if I
even
go for
after,
a couple,
so it's okay. It's okay.
I don't need to change.
And then, it's fine. And then things like that, people who think of obesity, it's not that obesity per se is the cause, but if everything else along with that comes in, you throw in obesity, could be a cause. So maybe we need to work a little on lifestyle, diet, stress. Now, when I say stress, I'm not talking about the regular stress. Stress about, people who don't sleep. Does it affect? Definitely affects, because it's hormonal, right, at the end of the day. So, it's going to affect you. So, people who are unable to sleep, I'd like them to get some sleep, adopt a lifestyle which actually feels more holistic. And then go forward. There are times I tell them, go for a detox massage, Ayurvedic, go for acupuncture, jo bhi hai. Just make sure anything that can help the couple needs to be put in place before we go for the next cycle.
I think you have to be mentally and physically ready. It's not only a physical journey.
It's absolutely not. Like I said, there are 4 people involved in this journey, right? So the physical body, which is your habits are part of your physical body. Your diet is part of your physical body. Your nutritional status is part of who you are. What you eat is what you are. Hippocrates once said that, let food be thy medicine. Your food should be your medicine, not necessarily. So that all those foundational stones need to be put in place before we go and build that building on top of that. So this will be something that I would want to. And go back towards whatever reports they have, get that out, study them, maybe sometimes get a geneticist involved, maybe get the lab director involved, things like that, nutritionist involved, get the counselor involved, everybody who can help with the couple to move forward. It's a multidisciplinary approach that needs to be done. Not necessarily always with the first cycle. Even the first cycle, I think it has to be multidisciplinary when they go ahead.
One more thing I wanted to touch on is miscarriages. Yeah, women go through miscarriages. It is more popular than we think it is, right?
Yes.
I think it was, I don't remember the statistics. I went through it personally myself once, right? So then I read that 4 out of 5 women have gone through a miscarriage. It's normal. It's not spoken about. Does miscarriage also affect my future fertility?
Miscarriages, traditionally we've been told to, 2 or more, then you look into what is happening.
Okay.
But I'd say 1, start thinking why. The science says that if your miscarriage happened in the first 3 months of your pregnancy, 90% of the time it's a chromosomal problem. People come into my office and say, doctor, I traveled to India and I think it's because of that I had the miscarriage. I was doing night duty. Maybe that's why I had stress. Maybe because I lifted a lot of weights while I was, back home. That's why I had miscarriage. Not necessary. Honestly, not necessary. If you look at life around, if the embryo is very strong, the first 3 months, it should be able to withstand that weight that we're talking. How many kilos do we lift as, in our daily lives? 5, 7, not more than that. And I think our body is equipped to handle that. So if a miscarriage has happened in the first 3 months, most of the time it's because the embryo had a problem. If the embryo was not tested for anything, and if the couple haven't conceived in, let's say, 2, 3 or 6 months, whatever the timeline they're looking at, and they're not conceived, it is time to have a discussion that is there something that is important. The reasons could be inflammatory, it could be infectious, it could be genetics. Okay. It could be, this is from the feminine part that I'm talking about. The male side, it could be the sperm DNA not fragmentation. It could be the lifestyle of the partner. So it could be any of this. So you should be able to sit down with the gynec so that you understand. Some of them haven't taken folic acid or, prenatal vitamins. Now they tell, it is easy for us to compare because, we come from a nation originally where there are a billion people. So, they all having, and with the population, if it has exploded, they may not have all taken folic acid. But here we live differently, we think differently. So why not adopt prenatal vitamins before? Pregnancy is no longer a 9-month affair. It's a 12-month affair for both the husband and the wife. The egg with which you get pregnant today is the effect of your lifestyle 3 months backwards.
Oh, wow. I didn't know that.
Yes, it is.
Interesting.
Okay? The same thing to the sperm. The sperm takes 72 days to come into, the ejaculate of the sperm was produced 72 days back. So now whatever you were doing then has affected your sperm. So it is important to get all this in place and then go for conception. Recurrent pregnancy loss, if it's like, so when the doctor is testing you, if there's red flags, she will highlight it. There is an immunologist. There's a huge role for an immunologist to play. There is a role for a fertility doctor to play, especially if they find like a geneticist points out something. If then there is a regular gynec who's got a role to play. So the three of them, it can, whatever investigation shows as red flags, you can redirect yourself towards each of them and get advice, and then you should be good.
Got it. Interesting. Thank you, doctor. I want to move to the fun section now. Kafi, serious. I want to do a rapid fire with you. It's called Direct Dil Se. We got to know Dr. Sreelatha a little bit more. So I'll give you some options. Choose the ones which sync with you.
Okay.
Hope or science?
Science with hope.
Why do you say that?
Okay. See, if you understand the science, then hope stops being just a wish and more a plan.
All right. Patience or planning?
First planning and then patience.
And then patience.
Okay. The reason is, I think if you walk in without a plan and you just sit with patience, it would be called waiting.
IVF or awareness?
Awareness, always. Yeah, like I said.
That's what we're trying to do, I think, for everybody who's watching this episode. We're trying to tell you so much more deeper into the world of IVF because some of these questions are not talked about, right? And they're not openly discussed even today, although we've moved forward from a big step from where we were, from our parents' generation
100%.
But still, I think there's so much more awareness that we need to create. Healing or hurry?
Healing. The reason is a hurried cycle on an unhealed body may not always work.
Yeah. So we talk about the mental and the physical journey.
Physical, mental, emotional,
everything.
And I also would like to have the financial healing.
Of course, that has to be a part of it, isn't it? Emotions or evidence?
Evidence with emotion. The reason I'll tell you this is I can't separate them because I think, as a physician, it's important to be emotionally involved in the process. I've been told otherwise. I've been told, leave your emotions at the doorstep when you walk in. But it is very difficult because, you see this couple over 1, 2, let's say 3 months. How is it possible that you cannot attach yourself to this?
You're a part of the journey.
Yeah.
Right?
So it is like a partnership that we have together.
Yes.
So it is not possible to detach them. We don't let it consume us, but yes.
Egg freezing, and I think I know the answer for this one, but egg freezing, empowerment or panic marketing?
Empowerment.
Okay, one test every woman should take early.
If you're talking about the reproductive life, yes, it's the anti-Mullerian hormone, 25 years upwards. Get it done. Simple blood test. Your trajectory could change about your reproductive life.
One word families should stop saying to women who are trying to conceive.
Relax. I think that word relax is retired.
Yeah.
Because friends and family say, no, ho jayega. It's okay. Ho jayega. You just do this,
उल्टा लेट जाओ, उल्टा बैठ
हाँ, नहीं, हाँ,
जाओ, योगा कर लो.
yeah, or you just go ये मंदिर पे जाओ,
Yeah, मंदिर पे यहाँ चढ़ावा चढ़ा दो.
yeah, and all
Yeah.
that. But it's a medical pathway. If you're not
Mm.
getting pregnant, it is a medical pathway. For example, if you have a problem with, let's say you've broken your hand, what would you do? You'd go to the orthopedician, right? You need prescription glasses. You would see an ophthalmologist. They will give you prescription glasses. Does the ophthalmologist always give the same size or the same number of the glasses to every person who walks into his office? No.
It's customized, personalized.
It is customized.
Right? Yeah.
The same thing. Fertility treatments are always personalized. It's just that message, I don't know, we carry the stigma for IVF so much that we don't know. I was very proud of the fact that Isha Ambani actually came out and said that she did IVF. And, there are people who are talking about it openly. It's not fashion. It's just that they realize that there's something wrong. It's a medical problem and it needs to be fixed by a doctor. It can be simple. Goli se bhi chalegi, injection se bhi chalega. Kabhi kabhi operation ki zarurat padti hai. We still go to the doctors, right?
Yeah.
So I think you should just be open enough to go to the IVF doctor and ask what the opinion is, at least.
Wonderful. And my final question, I guess, what's your message to every woman out there who feels lonely, wants to get pregnant, doesn't know what to do? What's the advice you would give her?
In simple terms, I'd like to say that you are the Jhansi Rani of your life. Just pick up, go to fight. Incidentally, when you look back at history, I'm talking about Indian history, Jhansi Rani actually didn't fight for herself, if you look at it. She was married into that family. She was fighting for her stepson, right? And she was one of those few Indian freedom fighters who I thought was doing it very, very, very intensely for herself. She understood the worth of her battle. And I think, as like everything else, we get a little sidelined through women through age. I'm not being a feminist when I say this, but I think if a woman can stand up and fight for herself in this fertility journey, the partner will always be with her. If she steps down or she crumbles, then everything else crumbles down. If you ask me, a female embryo survives incidentally much, much, much better.
It's stronger, right from
the embryo. If you ask pediatricians, if they have low birth weight babies, a male baby and a female baby, they would always say the female will fight through it. So, the male is one which needs extra attention. So it is tough. It is not easy. It's not easy, the hospital corridors, the consultation rooms, the waitings, the conversations, the heartbreak. It's not easy. We totally get that. It is important for them to understand that we are also on their team. We're batting for them. Just reach out to us. We're here for you. And the second thing is, don't give up. It's easy to give up. And I'm saying this at different levels. What happens is one cycle fails, then they're down, they're out, and they feel, nay, I'm not going to do this anymore. So they just give up and they disappear. Then they relax. The healing process takes a very long time. By then, they lost time. And then they bounce back. So just go in and ask people if that waiting will help you or not. Because it's important. I'm sure there are different avenues through which your doctor can help you. So it's important, very, very, very important for you to go back, talk to the doctor. Even if you want to take a space between your treatments, take it. Talk to the doctor and take the treat. Because, she'll give you a different view. At least you'll have somebody, because there is something called professional bruising, which I don't think people realize. Every time a cycle fails, it affects us also.
Yeah.
My daughter says this, like, for example, if I'm walking home and I'm not in a great, she'll tell her dad, I don't think you should crack any jokes or have any flimsy conversations in the house today, because I think one of her patients is not done well, so she's in a bad mood. So it takes us time, sleep over, and the next day we are up. For us, okay, it's a whole new day. We have another patient who might get pregnant the next day, we actually get over that a little. it takes a week for us to get over that negative pregnancy test, whereas the couple are stuck with it by themselves if they are not having a conversation with anybody else. So it's important for them to reach out, talk to people, because it's a partnership. Like I said, your doctor is part of your journey. And if you've not done well, she's also hurt. So she will definitely want to see how she can help you in any way possible. So
thank you. That's wonderful advice. Thank you so much, doctor. खूब लड़ी मर्दानी वो तो झांसी वाली रानी है. So if you are a woman or a family on that journey, on that fertility journey, I think we want to tell you, you're not alone. We are very thankful to Almond Blossom Fertility Clinic for this wonderful conversation. I think for me, it was very informational. Lots of new terms, lots of new words I learned. And I'm sure everybody who's on that journey of building your own beautiful family, if you need a free consultation, we are very thankful to the clinic. We have Friday free for IWD. All you need to do is call them and tell them you are from IWD. Dr. Sreelatha has kindly agreed for that. Do book your appointments there. We'll be back with more campaigns and more fun with Dr. Sreelatha very soon. Please keep watching this. If you like this episode, share it with somebody who needs to see this, because we want to spread awareness. We want to spread the word and make more happy, beautiful families out there. Thank you.
Thank you so much. Thank you. Thank you.